Hi everyone, my name's Lydia. Welcome to my CT diagnostic toolbook. So I'm doing a diagnostic toolbook about the CT scan, and I decided to write a little book to describe what a CT scan is for my loose parts, neuro or spinal assignment. I decided to go with the spinal or like different parts of the body that includes like broken bones and all that to talk about what a CT scan is and how it works. So let's get started. So I'm going to play from the start. That should be CT scan. Let me write that in. So then let's start it from current slide. So this is my CT scan diagnostic toolbook. So my CT scan diagnostic toolbook will be used for hospitals, or you can teach it to your students in an elementary school, especially for young kids, probably like early kindergarten to maybe third grade. So this is going to start like, so let's say you have a friend who had a bad fall and hurt either their back, like the spine, their head, um, their leg, or their arm really bad, and there might be like a small like fracture where you have like a little bit of bone that's broken, or like in your head you hit your head really hard and there's some like you might have a bad headache, and so your mom take their mom takes them to the doctor just to check them out to see if they're okay. So they want to see how bad their back, their head, their leg, or their arm, how bad it's hurt. So the doctor decides to do a CT scan to look at their arm, their back, or any neuro or like their head stuff to see if any bones are broken in their body, or if there's like some like head trauma in their head from how hard they hit their head. So what's a CT scan? So a CT scan is also known, it's called a computer tomography. So it scans and takes a lot of special and very detailed pictures from different parts of your body, and also to see if your body will need surgery or not. So the CT scan uses x-rays, which are like pictures that look in the inside of your body to see your bones. It has a special computer that creates special images and takes pictures to look at our bones, our tissues, our organs, and also our brain and other areas inside of our body to get a better look. It's a very big machine, but it won't hurt you or won't touch you. But it does make sounds, but those don't hurt you either. So what you do is you lie down on this bed or table, you lie on your back, you do lay very, very still, and you do not need to move. Because if you move, then the pictures have a hard time taking and they don't look very clear. So and it kind of be really, really hard to see. So then when you go, the bed goes through the hole. It looks like a big donut. And it starts making noises, like it starts taking pictures. And it only lasts a few minutes. And then afterwards, the doctors look at your pictures to see if you don't need any surgery, or to see if there's any trauma from like your head or other areas that you really hurt. And if you don't, then you're okay. Or you may need just to take a break and be careful. Or if they do find something like your arm is broken and it needs to get surgery, so then you'll have to go put in for surgery. So the machine is shaped like a really big donut, and it does take pictures. So what happens when you get in the machine? Because sometimes kids will ask. So you need to lie down on the bed so it does not move. And then you have to put on a very special hospital gown. So to make sure that you're wearing it so they can see throughout your body, and being and lying very still so they can see all the pictures very clearly. So then the camera, once you're on your bed, you're very still, and the bed goes through the big donut hole. The camera starts making buzzing noises because then it means they're taking pictures. The pictures or the noises will not hurt you. It just makes sure that they can see throughout your entire body that they can find anything that may need surgery or looks not normal, and they may need to make sure that you're okay. And this doesn't have to be a break or anything. This happens if you're having a really bad tummy issue and you're not getting better. They want to make sure that your body and your insides of your stomach or other parts near your stomach is okay. And also, like, your mom and dad can be with you the whole entire time. They can talk with you, they can sit with you, making sure that you're okay and that you are still. And after the few minutes, the procedure is all done. So, what does a CT scan look for? Well, you can see up in the top right hand corner, it can see that, oh, your bone is broken. It's not right, so that you may need to get surgery on your bone. Or if it does not need surgery, it's just like, oh, you just need to get put in a cast for a little bit to make sure that your arm is okay. So a CT scan looks for hidden problems. The doctors use it to look for broken bones or head trauma or other parts that may cause an illness in your body. It's like a big X-ray. An X-ray is where it takes pictures of the inside of your bones. So it could be more serious or even deeper in your body to see. So the doctors, it's like a big construction map of our body. It helps doctors look and see the size of our organs, like our heart, our brain, make sure everything is healthy and doing their job correctly without any problems. It also helps us find the ouchies in our body. Like if your friend falls down and gets hurt and may need a cast or surgery, then the doctors can say, oh, yep, there's a fracture, which means your bone's broken. You need surgery. Or, no, you just may need to be in a cast for a little bit. Then we'll make a cast. So we're going to do a step-by-step procedure for new kids or parents that have an ouchie or an illness in their body. So step one, before your scan, make sure we don't eat or drink any food or liquids before our CT scan because it can cause our tummy to be upset and cause throw up, and we don't want any of that. And then your mommy and daddy can help you practice with you lying still, like on the floor or your bed, while the doctor's taking, or the x-ray technician, their job is to take the pictures of your hurt arm. So lying very still is important. So you can practice lying still anywhere. Also wear comfortable clothes, like your pajamas or your short, or like gym shorts or a comfortable shirt. And also you can bring a stuffed animal or a blanket to make you feel cozy and comfortable. Step two, preparation. When you get to the hospital or the doctor's office, you go into the CT scan room, where an x-ray technician, their job is to take the pictures of your bones or your inside of your body. Still, their job is to explain what's going to happen and what the machine will do. So they'll take you to explain the machines, like, okay, what this machine's going to do is can take pictures of your body. Your job is just to lay still and be comfortable. Then to make sure that you're not scared. And then you're going to put on a hospital gown, which looks like that one up in the picture. And also your parents can be there too. And also making sure that you're just lying comfortable and you're being still. Step three, positioning and securing. So getting into the position, the x-ray tech will make sure your gown is on, and they'll guide you to the bed or the table and help you lie down on the table or the bed before we'll go into the scanner. Your parents, make sure that they're also wearing a protective gown, can sit next to you. You make then the x-ray tech can see you on the bed. If you don't need a seat a belt or pillows to make you comfortable, then the technician will make sure that you're lying very, very still. You can hold your stuffy or you can have your blanket next to you. Then the table, after everything is secure, The technician will slide you into the large donut hole-shaped CT scanner. And then next is the scan. So after you are fully secured and comfortable, the technician will move the bed slowly into the large donut CT scan machine. Then the X-ray tech will go into a room next to you where they can see you and also can talk to you through a microphone. The machine might start to make some buzzing noises, but that's not scary. It's just the camera and the machine taking pictures of your injury or your illness from your body. You can see in the picture up here, the little boy has his hands up, so that to make sure that he's lying still, that they can see his whole stomach. And you can see when you're going through the scanner, the scanner will light up into colors. And then some parts, the technician may ask you to hold their breath for a couple seconds. So it's just not for very long, just for a couple breaths, you may need to hold it so they can get closer to your pictures and to get deeper into your body. And staying still is so important. Then and then after a few minutes, the scanner will be all done. And then the doctors and the technicians will see how good your pictures are. And if they need to do it again, then they'll have to do it again. Then the final step, after scanning is all done, and if the pictures are looking good and that the X-ray tech does not need to do them again, then they will come in, they'll help you up, they'll remove the pillows and straps if they were needed, and then they'll help you sit up, and then they're going to give you some liquids and some food to eat. And they're going to tell you you did such a good job for being brave. So getting lots of rest and eating plenty of food and liquids after the CT scan is done. Then, once everything is done, the X-ray techs will talk to your mommy and daddy about how everything is looking, and then they'll send those pictures to the doctor. The doctors will call your mommy and daddy and say, okay, we looked at the pictures. Everything is looking good. We don't see any bone fractures. We don't see anything wrong with your brain or your head or your spine or your leg or arm or anything else. Like we don't see any bad stuff near your stomach or anything. So, or also with that, if they don't need surgery, then like, okay, then your arm or leg may need to be in a cast and just need to take time to heal. Also with your tummy as well. And then there is also a video that demonstrates about a child getting a CT scan. You can, it's very, very good. It's only about a minute and 52 seconds long. It's a very quick video about how a child getting a CT scan done for the first time. I looked at it. It's very, very good. And that can also be shared with, and also teachers or there could be videos at the hospital about children getting a CT scan, or the X-ray tech can find a video, or your parents can find a video about anyone getting a CT scan to prepare for them, especially if this is their first time. All right, that's my last slide. This is my diagnostic tool for my loose parts spinal or neuro presentation. So I did a CT scan diagnostic book about how a CT scan is used. And this can be used in schools, hospitals, nurses' offices, or anywhere that is used for any medical setting or school setting. I hope you guys enjoyed my presentation. Thank you so much. Bye.